Unlike women, men produce sperm cells every time in their whole life. Women are born with a constant number of eggs and they use that egg pool whole their lives. When women is over 35 years of age, the number of eggs is very low. It's declined. So women have a biological limit for having pregnancies. But men is different from that. Men produce sperm cells every month and this happens all their lives. So they can have pregnancies all their lives. There is no age limit for men. But when men's age advances, there are some differences. There are some tricks in the men's sperm parameters. The volume of the ejaculate, some of the sperm cell counts might differ compared with the young age men. But usually men can have babies at any age they would like to. If a couple is having difficulties achieving pregnancies, then at the first evaluation, at the first step, we ask men to give sperm tests for evaluation. If the sperm parameters are not good, then the fertility potential of the men is low. But regarding the sperm parameters, we also do some hormone tests. In men with hormonal abnormalities, hormonal supplementation by tablets or by injections might improve the sperm's parameters or the man's fertility potential. In some men, antioxidant treatments also improve sperm's quality. So we also have to do some tests to see how the sperm quality is by DNA fragmentation tests. Antioxidant treatment with hormonal supplements in selected patients under a doctor's or urologist's guidance might improve your sperm parameters, and that might help you with achieving pregnancies. For a sperm test, the man has to have a sexual abstinence period. It has to be like 3 to 5 days. If it's shorter than 3 days, then the count of the sperm cells might be lower than expected. Or if it's more than 5 days, then you can have problems at the test result regarding the motility, the movements of the sperm cells. So it's best to have 3 to 5 days sexual abstinence before you go to a test center. Sperm test cells are usually performed in special laboratories or in IVF centers. When you get a schedule for the sperm test, on that day you go there. There is a special room for you to give the sperm test. But you give the old sperm sample into a cup. The analysis will be performed under the microscope, and then as a result, at the test report, you will see your sperm count per milliliters and sperm volume and infection parameters, sperm's motility, and any morphological abnormalities at the sperm. If there are any more specialized tests asked for you to given, the laboratory will also analyze that, like sperm DNA fragmentation. That will also show your fertility potential.